think it's important that we acknowledge diversification is very attainable for us. We have put a lot of effort. We've built the infrastructure, we've built the education, the public education system to allow the healthcare system to allow a healthy, diversified economy. That is all attainable for us. We don't need to be scared that those things are out of our reach. I think that's important. A healthy, diversified economy is something we have fought for and worked towards in West Virginia for generations now, and we should take heart that is attainable for us. We deserve it, and we can have it if we just keep working towards it. And we'll always have coal mining. It's never going to be what it used to be in the 50s or 60s or even the 80s or the 90s, because the coal just isn't there anymore. It takes millions of years to make new coal, and that's not happening on our timetable around here. So we can be smart about the future of coal. We can preserve coal production as a critical component of our economy, but the only humane way to do that is by investing in the protections of the people who will continue to mine that coal as we do grow and diversify our economy for the future. One of the things that the union did in the 40s and the 50s is they created a system of hospitals in the American coal fields. Over the years, as the coal industry declined, those hospitals have largely converted to nonprofits, which are funded through Medicaid largely and through federal healthcare dollars that are being canceled by the Big Beautiful Bill. So one of the other things that the Big Beautiful Bill is terminating is this history and this network of miners' hospitals and health clinics that was created by John L. Lewis and the UMWA. And we are also working through the Black Lung Program and otherwise in the union to try protecting those facilities.
All right, I think.
Does that make sense?
Yes, it does.
Do you know about that history? There was a woman named Josephine Roach. You should. I've got a book about her upstairs. Josephine Roach, R-O-C-H-E, worked with the union and with John L. Lewis to create these miners' hospitals. They called them the John L. Lewis hospitals, and then from those hospitals, there were spin-off clinics. And we still have a lot of those clinics here today, rural health clinics, the Black Lung clinics. And they're all going to suffer, and many of them will probably close if we don't find a way to minimize or reverse the impacts